Hello and welcome to Health Matters. I am Dr. Chillemi. I will be your host today. So on this episode, this is number 4 in my series on the knee. On this part, what we're going to do is we're going to go over the benefits and treatment options for the knee. We're going to explore all the therapy options for the knee. So on this podcast, we're calling it Healing Knees, the podcast where we explore the full world of therapies with a variety of treatment options to relieve pain and restore function. Today, we're really going to discuss everything from cutting edge physical therapy to regenerative therapy and everything else in between. So whether you're an athlete with a sports injury or dealing with an age-related injury, we've got you covered. So let's get started. Physical therapy. So let's talk about this. Physical therapy is often the first line of treatment for knee pain and injuries. Here's what you need to know. Physical therapy plays a pivotal role in both conservative management and post-surgical recovery of the knees. Here are the benefits. Non-invasive physical therapy is non-invasive approach that involves motion and movement, and it doesn't involve surgery. That's the good part. Physical therapy has tailored programs where your therapist can design individual exercise and rehab programs tailored to your condition. Physical therapy is going to work to improve strength and stability. Physical therapy is going to work to enhance the muscles surrounding the joint of the knee to provide better support of the joint. The stronger you make that area, the better chance you have of not re-injuring it. Physical therapy is going to work to increase your motion, increase your flexibility. They're going to do that by specific exercises and stretches. Physical therapy helps you regain motion and flexibility. It is different than you working out at the gym. Sometimes patients think the exercises are very light and everything is purposed and point. It's not the same. You will not recover the same. You will not heal the same. You will not have your injuries heal the right way without doing your physical therapy. That's just the bottom line. Your scar tissue will end up forming, and it will lay down usually in the wrong directions, which is why you have to do physical therapy. Okay. Physical therapy can help with pain management by doing modalities such as ultrasound, electric stimulation, cold laser therapy. They can utilize therapies to reduce swelling by using manual therapy and certain exercises to decrease swelling, as well as using ice. With tailored programs, physical therapy can help in preventing further knee injuries by addressing the underlying issues and teach you proper body mechanics. Physical therapy is also paramount to post-surgical treatment. It'll help accelerate the recovery. The structured program can help the patients return to daily activity more quickly and safely. And you'll get optimized surgical outcomes. PT ensures that patients regain their full functioning and full motion as much as can be after surgery, potentially improving the longevity of the surgery and repair or replacement. Listen, you just had surgery. Do the therapy you need to do so your surgery could be a success. You know, I have no idea how many patients didn't do therapy, or started it for a week or two and stopped. And then they wonder why they come back in a year or 2 years later and say, surgery failed. You have to do your therapy. It's part of it. Okay. Next thing we're going to talk about is regenerative therapy. Right now, regenerative medicine is everywhere. Any athletes that you've seen get back on the field faster, I will bet dollars to donuts that they are doing some form of regenerative therapy. They are healing faster and faster. And let's face it, whether it's the 90s, 2000s, 2010s, and 20s, a torn ligament is a torn ligament. It's just going to take time to heal. What's changed is regenerative therapy, because regenerative therapy is the new promising field to regenerate joints. So regenerative therapy can include PRP, platelet-rich plasma therapy, umbilical cell type therapy, which is human cellular tissue products, Wharton's jelly therapy. Those are all new products that are out there that you should do your own research for. So what are the benefits? Natural healing. PRP leverages your own body's healing properties by using a concentrations of your platelets from your blood. So the way it works is you get a vial of blood taken out, they put it into the centrifuge, it spins it. When it spins it, your red blood cells drop to the bottom, your platelets are on top. Your platelets, in our office, we call that liquid gold. We take that and put that into your joints, and that helps heal the joints. Your body helps heal it. There are growth factors, proteins, and different elements in there, your good stuff, to help heal those joints. They're going to help do that by reducing inflammation, promote tissue regeneration, and the procedure is minimally invasive. PRP is typically an outpatient and no downtime. Umbilical cell, human cellular tissue products, and Wharton's jelly products are another form of regenerative medicine. They are typically found from cells in the umbilical cord and Wharton's jelly, and can potentially regenerate damaged tissue. They can help with anti-inflammatory. These therapies can reduce inflammation and pain. Again, minimally invasive, similar to PRP, usually performed as outpatient. Next, let's talk about medical treatments. Medical treatments include steroid injections. So in my previous video, I did go into a little rant on steroid injections, and I will go into it again. I will just tell you really quickly. Okay, so corticosteroids. The way it works is corticosteroids are great for stopping pain short term. Now, the way it does that is it stops the area, it decreases the blood flow to the area. So when you decrease the blood flow to an area, that area dries out. So you take down the inflammation. That's what it was intended to do. But here's the caveat. When you take down that inflammation, your body becomes dry. The drier your knee joint becomes, the more likely you're going to have to spike arthritis. Because that joint that's smooth, your cartilage and all your tissue in there, your synovial fluid, when you decrease the fluidness of that area, it becomes rough. And then it becomes breaking, almost like sandpaper. So imagine this. Imagine this. You could take two marbles and rub them together. That could be a good joint. Now, take two soft pieces of sandpaper and rub it together. And you tell me which one is going to feel better. When you rub two sandpapers together in your knee, that's when your knee hurts. You end up spiking arthritis when you take steroid injections. That's just the way it goes. And the truth of the matter is, you can only do a maximum of 3 per year because the doctors are afraid you're going to rip your tendons. And that's just a fact. So you have to make sure the benefits outweigh the risks, right? So the benefits for today might give you a problem next year, 3 months, 6 months, 12 months, 24 months. Think about that. Non-surgical. So the problem with this is, again, repetitive, can cause ligament damage and weakness. Okay, what are some of the other things that they can do? They can do surgery. So there are different types of surgery, whether it's structural surgery or or basically there's a few other ones. There's arthroscopy or all the way down to total replacement. So there are a variety of surgical conditions that you can have. So some of the pitfalls with surgery is invasive, right? Requires significant recovery time. And like any surgery, there are risks such as infection, blood clots, complications, especially from the anesthesia. I've had patients have a blood clot from a knee surgery, from a knee replacement. It's happened. I've literally seen it in my office. And I've had successful surgeries where the patient's knee was bent 30 degrees. Successful surgery, they said. Patient can't straighten out the knee, but the joint has space, right? So the joint has space, that's what they were looking for. But they can't fully extend the knee because the ligaments behind the knee shortened. Now what? That's it. That's how you're going to stay. There are no going back from surgery, right? Think about that. Conservative care, conservative care, conservative care until you can't do any more conservative care. Because once you're in there and you're cut, you can't go back. Just a suggestion. Everybody has to live with their own choices in life, but there is no going back. There is no rewind button with surgery. With therapy, therapy's always there until it's not, right? I'm not going to sit here and tell you that there aren't times where you need surgery. 100%. There are definitely times you need surgery. I'm only going to suggest be conservative for as long as you can be. Because once you make that decision, there's no going back. And there are significant downtimes. Especially the rehab. The post-rehab could be extensive and intensive. So that's going to give you the basic overview of treatment options for your knee. You could do PT, you could do OT, you could do regenerative therapy, you could do different types of injections. There is one other injection that we didn't talk about, which I'll mention right now before I finish, and that is the gel shot. They call it the chicken shot because they have it synthetic from chicken, and the synthetic type fluid. It's basically what I will call WD-40 for your knee. Why? Because what they'll do is they'll try corticosteroids for a period of time, and then if that fails, then they'll go to the gel shot. And the gel shot is meant to kind of kick you down the road until you need potentially surgery. So the gel shot, again, is WD-40. So it'll help for 1 month, 3 months, 6 months. And then you'll need another one, and another one. But it's never going to fix it, right? So it's just going to give you a temporary fix. You're going to get that squeak in your door stop for a short period of time, and that's it. Okay. So there you have it. That's a comprehensive look at a variety of knee treatments that are available today. Each treatment comes with its own set of benefits and downfalls. The best choice depends on your specific condition for the severity of your needs and your overall health and lifestyle. Always consult your healthcare professional to determine the most appropriate and suitable treatment for you. Again, as always, these are my opinions and my opinions alone. It is up to you to see a physician for your own condition. This is not medical advice or treatment options for you. These are just my opinions. Okay, with that said, get your knees treated the right way. Do the right thing, and your knees will take care of you. You only get 2 of them. It's important to take care of them. Your knee health is critical for your overall health. And what I always say, your overall health matters because health matters. And if this can help anybody you know, please pass it along. Please hit the subscribe button. Tell a friend. You might just help them get to the next level of care. Health matters. This is Dr. Chillemi. Be well.